Good morning, everyone. This is Nicole with the Success by 6 Provincial Office. Thanks for joining us for webinar number 5, the last in our webinar series this spring. This webinar will be covering early years screening networks and health fairs, best practices from across BC. So I'll just go over a couple of technical aspects of the webinar before we get going. So as far as the audio goes, we will be keeping everyone on mute, so to limit the background noise coming in on the webinar. If you have a question, the best way to get your question in is to enter it in the question box. You can see that on your webinar panel. There should be a heading that says questions, and you can type a question into us. We can either answer that question back to you through the question box, or if the question is related to something that's being discussed at the moment, we can ask the question to the presenter and have them answer in real time. Otherwise, we will keep the questions on file and ask them during the question period. If you have a question that you would like to ask through your audio, please feel free to raise your hand during the question period at the end, and we will try to address these questions and have you unmuted so you can ask the question directly. One final thing, we will be sending out a follow-up email with any resources and links to the recording, as well as a copy of the presentation file so you can explore further and click on any links that you see in the presentation. And with that, we will get started here. So again, if you have any questions, feel free to submit them through the question box, and we will get back to you as soon as possible.
Thanks so much, Nicole, and welcome everyone to the 5th in our webinar series. It's really been an incredible series, this being really the culmination of a tremendous amount of work and participation of early years community developers from across the province. Our webinars have covered everything from supporting parents around free government education grants from the provincial and federal government, looking at developing a children's charter and the inspiring process that many communities have embarked upon around recognizing children's rights at the center of their early years community development work. From there, we talked about State of the Child reports and the interesting and compelling work that's going on in terms of taking data that relates to families with young children and overlaying different sets of data and metrics in order to make a compelling case for the need for communities to mobilize around families with young children. And most recently, last month, we talked about new and innovative models of early years planning, planning tables, leadership models, and what that looks like in several communities across the province. So if you haven't had a chance to participate in those, I would strongly encourage you to go to the Success by 6 website and check out those interesting, thorough, and inspiring webinars that we've been able to put together with your colleagues from across the province. So without further ado, we'll shift our attention to today's webinar. And this, as I was mentioning, is something of a culmination because we're thinking of both some of the research, the practice, the actual reaching out to communities, but really at the base of it, we're thinking about best practices in the early years and in early years community development, and really getting at the heart of how to really make change and make a difference in trying to improve early years intervention and identification of developmental delay and developmental concerns in the early years. So we have presenters from across the interior of British Columbia. We have many people on the phone who are part of the webinar, who are doing their own children's early years events and screenings that I'm sure will have some important information to chime in and offer both questions and thoughts on their own experiences around early early years screening practices and health fair events. But I think at this point I'm going to turn it over to Linette, who's going to give us a really good sense of both the, I guess, the research basis for early years screening as a central activity of your early years planning process, and from there talk about what is really an impressive model of how an entire region can address this issue of early years screening in a thoughtful and methodical, systematic way. So with that, I'll put it over to you, Linette, and as we move forward, I'll take a moment to introduce our new presenters at each time. Over to you, Linette.
Thank you, Joseph. Thanks for that nice introduction. So, hi everyone on the call and the webinar. My name is Linette Gratton, and I'm in the Interior region, as Joseph had mentioned. I have a really long title, and so I'll say it just so you understand, and then I'll say a little bit about our unique leadership model, which I wasn't able to speak to on the last webinar, and then how that actually informs our ability to put together this network that I'll be sharing. So my title is the Early Child Development and Children and Youth with Special Needs Community Development Advisor for the Interior region. So basically, I have an overarching support for all the early years tables and work that's going on, interfacing with numerous children and youth with special needs initiatives and support there, as well as I am the facilitator and leader of a unique leadership model in the Interior called the Early Child Development and Children and Youth with Special Needs Alliance. So that model brings together leadership from a number of different sectors, MCFD, Interior Health, school districts, and the Public Health Agency of Canada, as well as strategic Aboriginal stakeholders and leaders throughout the region to come together, share big practice models and any shifts in the organization that can inform the work that trickles down to the ground. So really trying to break down some of those silos and communicate with other sectors to be able to better perform our work. So that is kind of my overarching picture, and it is a unique leadership model that only exists in the Interior. And as I said, I didn't get to speak to that on the last webinar. But having this unique position of mine gives me the opportunity, as I said, to interface with a number of different sectors and to have some broad conversations around what things are impacting kids in the Interior region and beyond, and obviously specifically in communities. So I'm going to give you kind of an overarching history of how we actually developed this network to support all the early years screening programs and initiatives in community. So I'll give you a little bit of history of how we got to developing this and then what our network is about. So basically, in 2012, at the Alliance level that I just mentioned, we started talking about infant mental health, which obviously a very hot topic and important topic to be discussing in community and at a regional level. So in the Interior region, we actually have a document that was put together called the Early Childhood Mental Health Continuum of Services. And really looking at, you can see this triangle here, the different levels of intervention, from promotion all the way up to treatment. So we were talking about this at the regional level, and we really started to say, how are we going to identify kids earlier with early infant mental health issues? And so we just were conversing about that and really just trying to kind of figure this out. So next slide, Nicole. So one of the things that was informing our discussions was a slide that came from the Ages and Stages training. And it really stood out to us as an indicator that we really needed to utilize some tools in order to better identify kids and thus get them early intervention. And so this slide was something that really resonated with the members of the Alliance in regards to, with screening tools, we could definitely increase our identification and thus improve early identification and get some services and intervention in place. So this was kind of the catalyst of the discussions. And then we moved on to me interfacing with a group from the Lower Mainland called the Fostering Early Development Program, the slide that will come up next here. I was at the Early Years Conference and was able to be in their workshop where they were speaking about their program that was targeted for children in care and how they were utilizing the Ages and Stages questionnaire and working with the social workers, the foster parents, and other resources around early identification. So I was really keen on this because it was really linking into the conversations we were having regionally. So I invited the leaders of the Fostering Early Development Program to come to Kamloops in October 2012 and speak to our Alliance members as well as a number of other stakeholders to talk about their program and see how we could look at this from the interior perspective. So you can see what the FED program is about, and actually we have links on the network that I'll be sharing, so if you want to go into that a little bit deeper and learn more about the program, there's lots of information on there. But really what happened was this was a catalyst for us to talk about the interior region, our structure, our very broad geography and diverse communities, and from rural, remote, and urban. And it really led us to realize that, well, first, we actually didn't know what was happening around early identification with kids in care or in community. So it really got us talking about that. And we also thought, well, we have such a big region with such diversity, it may be hard to implement a program like they have in the Lower Mainland at this time until we could figure out more what was happening. So those conversations led us to say, hey, as I just said, we need to find out what is actually going on in our region. So that led to the support of the Alliance to do a scan. And so I went forward and would scan. So the next slide will, next slide, Nicole. So I have my slides a little out of order, but here, the Interior Health Region, they actually have some guiding principles about utilizing the Ages Stages questionnaire with 6-month-olds and some 18-month-olds in our region. So we actually had some guiding principles, and we actually had a universal place where families were interfacing with the Ages and Stages questionnaire. And so doing our scan, we wanted to find out what was happening in the broader community perspective in regards to going beyond those age groups and identifying kids in community. So that led us to the scan that I interviewed 43 communities around their early screening practices to get a landscape of what was happening. And so that would be the next slide, please. Oh, so not the next slide. The other piece that was informing this in our rollout was also at around the same time, you can see in March 2013, there were some recommendations for the use of screening tools in British Columbia to inform the infant development and Aboriginal infant development and supported child development programs. And the Ages and Stages questionnaire was the developmental screening tool that was recommended. So we are seeing clear information around using the ASQ as kind of the primary screening tool, and so then going on and figuring out a little bit more about what was happening in our region. The next slide just shows, I'm sure many of you are aware of the Ages and Stages questionnaire and the domains that it covers. So that's just also from the Ages and Stages training. And as you can see, it covers a broad cross-section of child development and even has an opportunity to go deeper into that social-emotional area, which we were very keen on learning about when it came to our infant mental health framework and how we could inform and identify young kids that might be needing support around their mental health. So now, my next slide, it talks about the fact that I did a screen. So we did a screen to find out what was happening and basically connecting with communities and asking about their early screening practices and asking them to share with us if they had any models, systems, anything that they were utilizing to screen children in their community. And what we found from this scan was we actually only had 6 communities in our entire interior region that had kind of formalized early screening practices put in place. We had lots of communities that were using the Ages and Stages through a number of different contractors, whether it be IDP or SCD or some community folks, but there wasn't really coordinated efforts around screening children in the broader perspective. And so that was really, really informative to us. And so what we heard when we were doing these interviews is in the next slide of when we asked the question, of how could we be supportive regionally around increasing the early screening practices in community. And so on the next slide, you'll see that communities expressed to us that they needed some coordination, they needed support and mentoring and support around networking, ongoing training, and some systems to support usage. They wanted to learn from each other and share information. And so we were like, great, we have something that we can go off and try and support them with really no money. So we were like, how can we support you without money? And they said basically sharing and connecting with others, because they didn't want to start from scratch, and most people didn't know where to start when it came to a broader community development perspective on early screening. So that was really, really informative, and it was important in the next steps of actually devising what this network could look like. So gathered together an advisory in 2013 to guide the development of our network. So people who had done lots of work around early screening, had different models and practices to come together and share and help us develop what this would look like. So we were able to put together a wiki space. So that's the next slide there. And this is our network. We utilize a wiki space to hold information for people to be able to interact and be able to get to links of all different information and to organize the information. So this is a screenshot that's up here of our homepage of our network. And then you can see just from the screenshot on the left-hand side of a wiki space, there's all these pages. And all those pages hold information that could be supportive to communities and individuals as they go forward in their early screening practices. So you can see there's a link here. And so as Nicole had said before, everybody's going to get the PowerPoint. So you'll be able to link right into our wiki space, and we welcome everybody to go and take a look and see what's there and if there's anything that can be supportive in your practice, even if you're beyond the interior region. So we launched our network in 2014 after the advisory had supported us in being able to put it together. And as you can see, it's really just a place to share information and ideas and support the stakeholders in the interior region and beyond. You can see the next slide are what our vision and mission is. It's also housed on that homepage of our network. And you see basically we have this broad vision that children will have access to developmental screening in their community, and that we are just a resource to support the interior as they develop those screening practices, and the information that we share about promotion, access, best practice, research, evaluation, education and information, and more. So it continues to develop, and really our network is driven by our stakeholders. So we're always just trying to make sure that we're listening, we're adding information, and we're trying to engage with the folks throughout the region to get them to share their resources and share their ideas. So, so some of the examples are there's some resources such as posters, brochures, mile charts, all kinds of different things that are housed on there. We have different models that are shown on there, different ways that communities have gone forward and figured out how to work in their community. So we like to share that practice. Other thing that we have is a map of all the interior region early screening committees. So we have an interactive Google map that here's a screenshot of it here, and so you can see where the communities have early screening committees or early identification committees, and you can see there's a link there, so you can go on to our wiki space and see in the interior what communities are doing what, and when you put your cursor over top of any of those little communities, there will be a pop-up box that comes up, and that explains that community's approach to early screening. It will provide you with a contact to somebody in the community. It might give you a website link and just some general information about how they are doing screening in their community. And that's the thing with our network is we're not coming in and saying this is how you do early screening. We're providing a whole bunch of ideas, information, and resources so communities can find their own way in their community development process. So as the stakeholders said, they didn't want to start from scratch. They wanted to learn from each other. So we're trying to provide the venue where people can come and get those ideas, bring it back to their community tables, back to the community stakeholders, and be able to talk about it in their community context and look at what maybe some other communities are doing and see if there's anything that fits or is relevant for them. And that's what it's about. So we definitely have pages with lots of templates and things that can come back to a community table that can help refine the vision, maybe the target group, who the stakeholders are in community that may have training, have kits, who need to be part of it and part of the conversation. We have templates that can help communities weed through the risks and the benefits in their communities and figure out how to mitigate those risks. And that's a really big thing because communities are always worried that we have limited resources, and by more identification of young children that we're going to not have the services to be able to support the families if issues come up. So those are really, really important things that need to be talked about at the table and on the community level of how those things can be mitigated as you go forward in the early screening context. So as I said, just really trying to support communities to find their own way in this. And this map, if you're interested in taking a look at it, will show and highlight that we have lots of different ways, approaches, and models throughout the interior that communities have taken on in order to meet their approaches. Right? So our next slide is just, we're always evolving, as I said, we're always trying to keep our network up to date and sharing new and relevant information. We're often going on and finding videos that talk about sharing information with parents. We utilize the Ages and Stages questionnaire website because they obviously were utilizing that resource primarily, and they're continually updating their website and are putting together great resources to support this process. So we're trying to always link people back to that information and create that opportunity. So as you can see through our early screening development, we've had some opportunity to directly network and connect. Our first gathering was in May 2014, where we brought 75 people together to first talk about some of the next steps in early screening. It was a networking opportunity, and we also had our first opportunity to connect and hear from the Human Early Learning Partnership around some work they were trying to do. At the time, they were calling it the Ages and Stages Plus, and it's now changed names into the Toddler Development Index. And so they were asking questions and sharing research with our stakeholders around developing this tool. And I think Dory from HELP is on the line, and we'll get her later on because she'll be on mute to be able to share some information about that work. But we also had another opportunity to come together just this last April in Roslyn. We had 52 people come together to go even deeper into our early screening practices. We had Dory and Anita from HELP who came and went deeper with everybody in the development of the Toddler Development Index, and really had some engaging opportunities there. And we've also had other training opportunities around the cultural adaptation of the Ages and Stages questionnaire and some train the trainers as well. So going on to our gathering. So as I said, we went to Roslyn in April, and we had a great opportunity to connect, share models, practices, all the things we try and do on our network. And we also had an opportunity to kind of really get into some small groups and work on some of the really hot topics that come up in communities. So you can see here we're talking about mitigating referrals and wait lists, strategic planning, implementation, and not reining but training and mentoring, as well as we had the group from HELP to be able to get some direct feedback around the continued development of that tool. The next slide just shows some of the stuff from the gathering. So you can see that some of the sharing. We had a trade show kind of showcase where communities were showing some of their implementation binders, their kits, and other things that they've developed in their communities to further enhance their early screening practices. There's pictures here of some of the small group work that was done in the afternoon around those hot topics where people were able to share and get ideas from each other, and those were facilitated by folks from the advisory, and being able to just elicit lots of conversation. And all this information from the gathering is up on our network, so you're going to be able to see it and the notes that were taken from these afternoon conversations. So I encourage you to be able to go on there and take a look at what was talked about in those groups and see if any of those things are relevant to the conversations you might be having in your community. And then basically the next steps for our region is just continuing to support the development of some best practices and support you guys even beyond the interior. We want to go deeper into more of an implementation and mentorship program that can be utilized to really support communities, because that's an area where communities can get stuck, and so we want to be able to build something there to further support them. We want to secure some more funding to train more trainers, so we can have more people able to utilize the ASQ in the region. And we want to go deeper in working with MCFD locally, regionally, and provincially around children in care. So I said in the beginning, the Fostering Early Development Program from the Lower Mainland was actually a catalyst for our conversations and the development of this network. But when it comes to deeper kids in care screening, we have only a small couple programs happening throughout the region, and we really want to work with MCFD and local teams and regional teams to see if this is something that we can look at supporting foster parents and good outcomes for kids in care. So that's pretty much from me. Any questions or anything from Joseph?
Thanks, Linette. I think we're certainly getting a few questions and thoughts coming in, and I'll encourage everyone who's part of the webinar to continue writing in your questions. As I think Nicole mentioned earlier, our way of going about this is to get to the end of each section and have a few questions, and then we'll have time at the end of our session. We've got about 10 or 15 minutes planned for hearing from people like Dory and I think Cheryl on Vancouver Island has got some experience in events there as well. But I guess for now, a few questions that came up in your very thorough introduction to the screening network and the processes that have been going on. I think the question would be, if I'm a regional early years coordinator and a planning table perhaps in the north central of the province, and I was hoping to try and undertake a similar regional screening network. Could you just once again kind of give us a quick run through of what are those steps that I could take in terms of building on the work that's been accomplished in the interior and starting a similar type of network in other regions across the province?
Yeah, I would say if you're looking at a network like our Wikispace, then pulling together an advisory committee to help form that, I think, was really important and foundational, because I wanted inclusive views from all different communities and experience to inform that development. But I would say that since we already have a network, I would say, hey, jump in, and it's a public space, and so you're actually allowed to go in and utilize any of the information there to bring it back. So you are allowed to take what you like back to your region, so feel free to do that. And I think utilizing some of the resources that are on our space, especially around the community development process, could be a good starting point, and figure out how that could look for your region. But I would say don't reinvent the wheel, steal from us, and we're welcome to share that. So, and I could be, you can contact me directly in any way that I can be informative to the process on what level you're wanting to do this.
Great, thanks, Linette. I guess I wanted to make sure everyone heard that twice, just because it's a great offer, and really thinking about this as a provincial-wide best practice that we're certainly trying to support. in all communities and in all regions. I think it's great that people can recognize that all these resources have been developed, even the structure and as you said, the many options of communities really taking what they need, depending on where they're at and their needs for implementing outreach and accessibility around screening. A lot of this work has been figured out for communities large and small, and even overcoming things like geographical and financial considerations. So thanks for that offer, and I'm sure that you'll have lots of people taking you up on that. I have another question about, you had mentioned sessions on cultural adaptations of the ASQ, and I know it's always an issue of discussion about the cultural appropriateness of different types of screening. Would you have maybe just a little bit more context about what that looked like in terms of training and work around the cultural adaptations of that screening that's being used?
Absolutely. So we actually have, as you can imagine, a page on our wiki space that's all dedicated to cultural adaptation. And the foundation for that work is actually out of Quebec in Okanagan, who through their step-by-step program has been utilizing the ASQ for a number of years and has done some really deep community work in order to make sure that the ASQ was reflecting their community. And so there's a whole a document that's come from Quebec that outlines the practice in that and what they did to adapt the ASQ. And in just overarching and saying that, it's actually not changing questions, because of course that is established in research and validity. So those can't be changed, but how the presentation to families is, and the acceptable questions in some cases are refined to meet a community context. That's all outlined in the document that's on the space. We also, with the training we actually had Nancy Rother, the lady who developed that document and did the primary work there. She came on in May 2014 through an online platform like this and shared their process with us in the region and a few people beyond. So we were able to ask some of those direct questions for her to further define that process, and that was really informative for us. But we really look to that guiding document that they've developed because of so many years' experience. In our region, the Okanagan Nation Alliance has taken that work directly and adapted the ASQ to reflect the Silks language and culture, and so they are going to be able to showcase that pretty soon. They're in the final stages of wrapping that up and getting the final pieces in place. So we do have examples of a community, a large nation that has done that work, and it's a great piece of work that they've done.
Thanks so much for that context, Linette, and I'll just comment that Corrine from the South Vancouver Island region will be following up with you as they're undertaking a similar type of, I guess, adaptation of the ASQ to make it, I guess, more culturally relevant in their region of the province. So I think for now we'll move on to the next presenter, but continue to keep those questions coming. There are a few we haven't got to yet, but I'm sure there's many on your mind in terms of both practical and also philosophical implications of this type of screening work. Our next presenter, we're diving a little bit more specifically into the network, and now Patricia, who is the community developer in the South Okanagan Similkameen region of the province, will be talking a bit more specifically about how that regional component has looked in her experience in supporting this work. So over to you, Patricia.
Hi, everybody. Can you hear me okay?
You sound loud and clear.
Perfect. Okay. So I want to reiterate some of what Linette just said. I have used a lot of the information on the wiki space and researched and used the imagery, that sort of thing, to develop our model for our particular region. So it's a great resource. What we have done is we have a two-tier kind of model. We have a regional component, and with the regional component, we have an implementation plan that is looking at our entire region, which is 7 communities, some of which are very rural. They're all quite a distance away from each other. And we also have that committee consisting of people from some of those different communities and service providers and other interested people, a parent, for instance, someone from our Aboriginal community, anybody that is interested in ASU in general can be part of our regional committee. Then the other component that we have on a regional scale is our marketing. And we were very specific about this because we want to make sure that there's brand recognition throughout the whole region. And because people move from community to community, and we want them to be able to see that picture that we are using, that we stole from someone else, and say, hey, okay, I know what that is. That's the ASU stuff. I can go there to get that for my child. And so that brand recognition was very specifically thought out in order for us to continue on with our development. And then the other regional component is our training and evaluation. So the training, we have conducted 3 trainings. We have over 50 new people trained in ASU throughout our region. And we did that, the one session was a training that was open to anybody. So service providers or daycares or parents or somebody from the library, that sort of thing. Then we had another training session that we worked directly with CCRR, and we put on this training session for daycare providers. And that was really neat because then the whole community of daycare providers, there was 25 people at that training, are able to support each other because they have gone through the same training. And CCRR is definitely supporting that community as well directly. So that's a really kind of neat model if you're thinking of doing training. And evaluation, we have a matrix that we have developed for each community, and then we take those matrices, and pull them together into a regional overview. And so everyone is filling in the same kind of information, so we have that consistency from each community. And so that's our regional, what we do regionally. And then what we do locally for each community, and I'll back up, we have implemented 1 or 2 communities at a time. We have not taken on all 7 communities at one time. We have planned this out as a 5-year project to implement. And so we have Okanagan Falls, we have Oliver, and part of Penticton up and running. And we also have people in all of the other communities trained, but we haven't done a full implementation yet. So we do that community at a time so that we can address particular issues. And so from each community, we have a local table and committee. And again, a lot of people that are on the ASU community are folks that are on our Success by 6 Children's First table because they are the service providers that are interested. So there is a bit of a crossover. And then for each community, we work together and develop an implementation plan. And that plan consists of who is going to be a mentor, and by a mentor, we mean which community organizations have been trained and are comfortable having conversations with parents. And then we also determine who is going to be distributors. And the distributors are folks that have not gone through the formal training, but are eager to help with the overall plan for implementation, and want to distribute the ASQ. And what we did for each of these folks, the mentors and distributors, is we developed binders for each one that was specific for them and would give them all of the information, and we can share those binders because they're fairly detailed. I can't get into that on here. But those mentors and distributors have the binders, and then we partner them up. So, for instance, in Oliver, we have Boys and Girls Club is partnered up with the community center. And when the community center is doing a program with little people, they distribute the ASQ, talk about it, distribute it, and when they come back, the community center works with Boys and Girls Club, who will do the marking of the ASQ and talk to any parents that would like to have a discussion. And we have the library in Oliver is the distributor, and they are partnered up with Desert Sun Counseling. And again, it's the same idea. One of them has the ability to do the chats with the parents, and they can support the distributor. And so far, that's been working well. And then, finally, I want to say, why on earth are we doing all of this? We have two stories I want to share that give very different perspectives of the ASQ and why we're doing it. So in Okanagan Falls, they were our first community. All of the strong starts in both school districts, they're a big part of the team. And at a Strong Start event, the Strong Start folks discovered that there was a little fellow, much to their surprise. They thought he was just quiet, but much to their surprise, he came back with needing some support. And he was 2 years old at the time. They talked to the parents, and by the time this little fellow was 3, he was on the wait list, ready to go into OSNS for some support. And from 3 years old to 4 years old, he has been working with the service provider. And turns out he was autistic and needed quite a bit of support. And then now he's 4, getting ready to head into kindergarten. And that's a really tricky transition, as we all know. And what has happened is the principal of the school, who is part of our team, has been able to apply ahead of time to get a teacher assistant, 17 hours of a teacher assistant in the classroom in kindergarten, ready for this child the day he walks into class. And she also has been able to tell the kindergarten teacher ahead of time, and so they are ready to support this child. And to me, it's a perfect example of how we've done early screening, worked with the parents, worked with a service provider, got the child the help that they need, and now everybody as a team is prepared for him for his kindergarten transition. So that's what happened in Okanagan Falls. And then at OIP, this was a really cute story. We found out there's a little fellow who is in daycare and was not speaking at all, and at all, I mean at all. And he was doing this, not speaking for quite some time. So they started to get concerned and decided to do an ASQ. And he was not speaking. And then his mother came to pick him up, and she saw that they were signing to him. And she said, "Why are you signing to my son? Is he learning a second language? What's going on?" And they said, "Well, no, it's because he doesn't speak." And she said, "What?" And she talked to her son, and her son, talked right back to her, no problem whatsoever. And everyone sat there with their mouths hanging open, going, "Okay, he does talk." And so they talked to the parent, and they did the ASQ. And it came back that this little fellow was perfectly fine, did not need support in any way. But what he was determined was to not talk when he was at daycare. And so they were about to start labeling him as, possibly having autism and other issues. But because they did the ASQ and talked with the parents, they found out that it was just a situational thing and that he is perfectly fine. So sort of two examples that are opposite of how the ASQ could be really effective. And we have done over 200 ASQs this last year, and we have about 1% or maybe 1.5% of folks that tend to get referred on. So it's definitely been worth it. We've been able to catch little people in our region that need support and get them that support. So that's it from us. If you have any questions, be happy to chat.
Thanks, Patricia, and thanks for giving us really grounding us in the concrete, some concrete stories about what this work is all about. Just the whole, I guess, the trajectory of assessment, identification, that targeting of early intervention, and really just bring us back to what is really the focus of much of the ambition of early childhood community development, which is a prevention-based approach to supporting parents with young children.
Yes.
You also gave us a good example of how in a particular, I guess, communities of a region, it's possible to create a community of practice around screening and early intervention, where the goal is clearly to come up with a common awareness and a common language in regard to screening and how to both talk to parents about development and really how to respond in a very systemic way, in the sense that the parents are hearing the same message and getting the same type of information wherever they turn to in their community. And that kind of consistency, as I think we can all agree, makes the job of a parent a bit less confusing. I think just where we are right now, we'll move on to our next presenter, and then we'll come back around to other questions at the end of our time, because we want to make sure we have time to hear from a few other communities. So we'll turn it over right now to Lynne Reside, and now we're moving, I guess, up the Okanagan to the North Okanagan, the Columbia-Shuswap region, where Lynne is the regional early years community development manager there. Over to you, Lynne.
Hello, everyone. I hope you can all hear me.
Yes, we can hear you loud and clear.
Okay, good. Thank you. Thanks, Joseph. My name is Lynne Reside, as Joseph said, and I am the Regional Coordinator Manager for the North Okanagan Columbia Shuswap Regional Early Years Network. And that is Children First, Success by Six Council Partners, as well as a Children First Early Years Network. Some of our communities have Success by Six funding, some have Children First, and some have both. So it's a very large region in our area, anyways, with 34 communities, and we have 10 community early years planning tables, as well as our regional Success by Six and Children First Early Years Network, and an Aboriginal Success by Six table. So I am the coordinator for the regional network for Children First and Success by Six, and I also have a small role of coordination with the Aboriginal Success by Six table. So of these 34 communities, many of them are very small rural communities, and if you were to drive from one end to the other, it would be about 7 hours of driving time. Just to give you a little bit of a geographic context. So I'm going to talk about early years fairs and health fairs, and also I'll talk a little bit about some of our early screening projects as well. So we have a regional strategic plan, which includes participating in the Interior Region ASQ initiative that Linette was talking about. And some people in our region sit on the Interior Region Early Screening Advisory Committee. And each community table has taken on a community approach to implementing ASQ screening. So the communities, because we are so widespread, the communities make their own decisions at their planning tables about how they would like to implement a community-based screening initiative. And they do that planning and they make those decisions based on their own community needs and their own capacity. As you can imagine, we have very small unincorporated communities up to the largest community in our region is Vernon, which is a small city. So the regional network is set up, our regional network, the North Okanagan Columbia Shuswap, our NOCS as we call it, is set up to allow opportunities for networking, sharing ideas, and sharing resources. And I would like to point out, just after Patricia's presentation, that that we have, I believe, quite a bit more coordination time, with each community having coordination time, as well as the regional coordinator time. So there are differences between our regions. Some are very similar and some are very different. Next slide, please. So in Vernon, the Early Years Fair is a partnership between the North Okanagan Early Years Council and the Okanagan Regional Library. So the North Okanagan Early Years Council is basically the Vernon Early Years table, but it does include two other communities, Lumbee and Armstrong. So they are in some ways subcommittees of the bigger council, but they do have their own limited coordination time, and they have their own early years tables in their communities, which are overseen by the early years the North Okanagan Early Years Council. So that's basically a community table, although even in itself it is a region, a smaller region. So in Vernon, the Early Years Fair is held in the library, and it's done every year in the spring. And it's been a great partnership with the library and with the Early Years Council. So usually there's about 20 booths, and those include people that we've invited from our stakeholders from the table mostly, and some other people from the community. So child serving nonprofits, our science center, our library, the North Okanagan branch of the Early Childhood Educators of BC, Interior Health, Strong Start, and kindergarten teachers. And just to put this in context, we hold it on a Saturday morning, and we had tried to plan for early years fairs previous to this and not had a lot of success because many people in the community are working during the day, and so we decided we wanted to try it on a Saturday, and we really had no idea how this would work, or if some people would not engage because they don't work Saturdays. And so all of the people and organizations that we approached, we asked them, is there a way that you could do it on Saturday? They all talked to their employers, even teachers and Strong Start facilitators who don't generally work on a Saturday. They were all able to get the time to flex their time and come on a Saturday morning. So we felt really really happy that we were able to do that, because it really meant that working families could participate. And on our first early years fair, we had over 300 families. So the library provides the space and the promotional materials, and then the Early Years Council provides funding for snacks and entertainment. So we had different types of entertainment. Last year there was Kathy Naiman Smith, who is a children's entertainer, I guess you would call her, and a Mother Goose songwriter, and we had a really great turnout for that, and it was great that we were able to provide funding for the cost of that, because that was a little more expensive than our more local entertainment that we usually use. So that's just one example. That's how Vernon has done it. I will let you know that the numbers haven't stayed at 300. They have gone down, and we are looking at why and how we can adapt things to make sure that we get lots of people out. So another community in my region is Golden, and for quite a few years Golden was given, the Early Years Table was given the Ready, Set, Learn funding to provide for an Early Years Fair, and when they did their Early Years Fair, they also included a family dinner and a family dance. So it was a real community event and an opportunity to share information and to celebrate families and for families to have fun together. And it was very, very well attended. And they had different focus, like early Ready, Set, Learn. They would say Ready, Set, Read, Ready, Set, Play. They just had different themes around the whole Ready, Set idea. But unfortunately, last year that funding was redirected by the school district. So this year what they did was they partnered with Child Care Resource and Referral, who do an annual Teddy Bears picnic. Mostly the focus of that in the past has been to celebrate child care providers and children and families with a fun event in the community. So when they call themselves the ECDC, the Early Childhood whatever it's called, Development Committee or Coalition, they partnered with CCRR for the Teddy Bear Picnic, and were able to really expand on it. And the beautiful thing about that one is that because it's outdoors, it's in the daytime, it's in the warm weather, they have it in their Spirit Square in the downtown area, then they were able to attract a lot more families than they had in the past. In the past, it had been more families that were already connected to services in the community. So in this, doing it in Spirit Square brought out all kinds of different families. It was very popular. They were able to give them lots of information. They had a DJ, they had dancing, they had singing, and it was just a fun event. So and to be quite honest, that theme of really making it a fun event was reiterated quite a few times by the different communities when I was talking to them about it. So then in School District 83, which is in the Shuswap region, we have 4 early years tables. And the school district gives each table $250 a year to sponsor an early years fair. And most of them are done during Family Literacy Week in January, and that's when the communities have an unplug and play theme. So the early years fair kind of follows along with that theme. They get a little bit of money to provide food, or maybe a little bit of entertainment or rent or whatever it is they need. And so the communities are Enderby, Salmon Arms, Sicamous, and Sorrento. And they're all pretty small communities. Salmon Arms a little bit bigger, but the rest are very small communities. And they still have a really great turnout. You know, most of them have told me they've had 30 or more people show up, and not in those small communities, that's really great. So in Sorrento, and Sorrento is the one community that has 17, Sorrento in itself is an unincorporated community, and then they have 17 very small, isolated communities that are situated around Shuswap Lake. So there are actually a lot of people, and sometimes a lot of children. A lot of those people are retired people, but there are also families that live out in those areas where it's really hard to even get into Sorrento, and certainly even harder to get into Salmon Arm, where most of the services are. So these early years fairs are really a great opportunity to share information and get to know the families and have some fun. So in Sycamoose, what they've done is they've had a visit from, they have a fair at the arena. This past year they changed it to the school just because the arena wasn't available, and they found that the families were much happier at the school, so they're hoping that they can continue to do it in the school. And it's also done in conjunction with Family Literacy Week. So they had a visit from Barney the bus and Bobby the boat. Those are both very important in those small communities where there's children spend a lot of time on boats and on the lake, and also on buses to get around. So they have these two characters that teach bus and boat safety, and they also had the fire department talking about fire safety, librarian doing a story in circle time. So you can see there's quite they don't have a lot of agencies in their community, but they are able to still do an early years fair with what they have in their community. And Salmon Arm, they've been holding their early years fair every year in the Downtown Activity Center, which is a very, very old closed school, and it has tiny little rooms and like a little rabbit warren. And so it's been successful. They've had lots of people showing up, but because it's a center where a lot of programs are offered and where people are already engaged, again, they were finding that most of the families that were coming were already the families that they were engaging, and they weren't really reaching other families that may not know as much about what's going on in the community. So this year they plan to move to a new venue. And some of you may have heard in the news that the school district in Salmon Arm had built a very controversial school board office. And there's a lot of hard feelings in the community because schools are being closed. And so it is very controversial. And so what the early years table decided was that they would hold a family-friendly event, the early years fair, in the school board office to get families into the school board office and help to build some bridges for seeing how this new building can be a community resource that really supports families. So they haven't done it yet, but it's planned for their next early years fair, and they're also planning to separate the parents and children at some point because they found that the parents are very distracted with the children, and so they want them to come together, but they also want to have some child minding so the children can have some activities on their own, and then have an opportunity to talk to the parents, because this is a time when they get so many parents out, and it's a real opportunity to share information about what's available in the community. So talking to some of the communities, I also really, what struck me was that many of them have really seen the importance of making your early years fair a fun event, and not to focus too much on maybe even screening or just presentations or information or that sort of thing. Some communities just give them a bag with the information and a free book to take home, but really important to have a theme. We've seen different themes that are fun, like the pirate theme or whatever, or to have a children's entertainer, or like some communities have done with the family dinner and dance. So that is, I think, a key learning that for the early years fairs. Now I'm just going to talk a little bit briefly about our early screening projects. So first, just from kind of looking at it from a regional perspective, our public health nurses in Interior Health do ASQ screening at the early immunization times, so usually at 6 months. And there are a few that also do it at 18 months, and a few that do the ASQ SE as well. And so that our regional network, the NOCS Early Years Regional Network, had developed a strategy to have all communities plan for and implement community-based early screening. And this took place when the Interior Region undertook their initiative with Linette, as she's talked about earlier. This was really, as some communities had already been working on, ASQ strategies, but being part of this larger network was very, very helpful in getting more activity happening around this initiative. And we've had lots of support from Linette. There are members who serve on the Interior Region Early Screening Advisory, some of them from our various communities, who share information back to our tables about what is being discussed at the advisory. And then there's the wiki space, which is just a great, easy resource to get at for everybody in all these, very diverse and widespread communities, to just get ideas, share ideas, problem solve, those sorts of things to help our planning tables to move forward with this initiative. Because many of them have very limited coordination time, and some communities have limited capacity as far as even having trained people with people trained in the ASQ, or having the time or resources to support this type of initiative. So we heavily rely on the Interior Initiative and on each other really in the NOCS region as well, because some of our communities are in the very early stages. All of them are actively engaged in using the ASQ for community-based early screening in some way, but they're at very different stages on the continuum. So some, yes, very early, just starting to talk to others in the community that are using the ASQ screening, and some have very well developed planning completed and are well into the implementation phase. So that's just kind of a general overview of the approach we took with our regional network and how much it fits into the larger Interior Region when it comes to ASQ planning and implementation. And I'm sorry this is such a boring slide. I did try to put some really nice pictures in, but for some reason it just wouldn't work. So just talking about some of our community approaches. So because, again, there's 10 different tables in 34 communities, each community table and each community has had some variations on their approach, but generally speaking, the approach is that this is a community-based initiative where we are trying to have the ASQ well known and well available throughout the community, whichever services families access. So Tracy Spannier is going to be speaking in a few minutes about Revelstoke, and Revelstoke is one of the communities in our region, and they have developed a very effective model, and so she will talk to you more about that. And also some of our communities have used some of their approaches that they have developed, and again, just to reiterate that the approach is always based on what works for your own community. So even though you can borrow from others, not every aspect of, for instance, the Revelstoke approach isn't necessarily going to work in a different community, but some aspects of it are valuable, and all of our communities, and in particular Revelstoke, have been very supportive of each other in just helping other communities to get on board with broadening the use of early screening with the ASQ. So again, I'll just talk a little bit about some of the communities. So and
Lynn, maybe we'll we'll need to move on in a moment. So if you could just briefly cover these approaches, thanks.
Okay, so thank you. I was going to ask you to do that for me because I really wasn't sure how long I'd talk. So I won't go too much into it because there is quite a bit already about the ASQ implementation. So I think I'll just mention some of these things that the public awareness piece is so important and shouldn't be overlooked. We have, in all of our communities, we've done some ASQ training, and we've also done train the trainer in the region, so that we have about 8 new trainers, which is very important because there's always lots of turnover. So some of the communities take a birthday party approach, some take more of a regular clinics approach. Vernon took the approach of having a dedicated ASQ staff person, and to form partnerships with childcare centers. And the every door is the right door is a term that Revelstoke often uses. So I'll just kind of end there so you can segue into Revelstoke and just point out that we've tried to be strategic across the region, but we've also been very much looking at the needs of each community. And I think I'll just stop there. Thank you.
Thanks so much, Lynne, and particularly thanks for giving us what really is kind of that broader context and really how your region has addressed both accessibility and structure in screening events and in planning. I think we're going to hear a bit more about that, the critical nature of destigmatizing screening for parents and really finding what we heard was just a great a panoply of events that combine information, dancing, food, and bringing that screening in as just part of that conversation. So thanks for giving us all that rich, very practical information about how this is done in the North Okanagan. So as you said, let's move a little bit deeper, and I think that's what the nature of this webinar has been about, is really putting our focus from this interior region and moving more and more tightly into a particular community lens. So with that in mind, let's turn it over to Tracy, who is the Revelstoke Early Years Community Development Coordinator, to talk about initiatives in her community. Tracy?
Thanks, Joseph. So I'm going to move fairly quickly because I'm cognizant of the time and I want to make sure there's time for questions. So I would invite anyone to contact me if questions come up beyond this presentation. So I'm going to go ahead and flip to the next slide right away. So I just want to tell a little bit of our story. We're a little bit ahead of some of the regional work that's happened. So we actually started in 2009. We had a community training opportunity through IDP, and we had quite a buy-in around the training. We had over 30 service providers, ECE, childcare providers in the room. And as we completed the training, we kind of looked up and thought, okay, now what? What happens with it now? Do we all just start doing an ASQ? What would that look like? How would that feel? So we developed the ASQ subcommittee, and we met for all of 2009 to really dig in and think about the challenges, what we were worried about, how we thought it might roll out, and kind of where we could go from there. We confirmed that we wanted to use the ASQ tool, so we did look around quite a bit at other models, what was available to us. And we also started to tap into other models that we saw. Kamloops was particularly generous in providing their images and information that they were using. I believe they started a few years before us, and so it was really great to have that support. And now with Linette having started in 2012 and all of the wiki and the other information that's available, it's so much easier to get started. So that's sort of where we came from. Next slide, please. One of the first things we needed to really do was to make sure that we had our goals pulled together and knew really what the challenges we thought were going to be and why we wanted to do this work together. Patricia talked a little bit about an implementation plan for each community, and that really was our case. We needed to figure out why we wanted to do this work. So first and foremost, we really wanted to reduce stigma. One of the first conversations we had was around, how does it feel from the parent perspective to be asked to do screening, to be asked to do an ASQ. And so one of the things we really wanted to gun for was that it just became a normal thing in our community. It's just what you do. And for that, we needed to do a lot of public awareness and really getting everyone on board at the same time. So we also wanted to make sure that while we were implementing the ASQ project, we also wanted to use that as a way to say to parents, hey, you can ask for help here, and that's part of that every door is the right door that Lynne mentioned there, so that families can sort of see that we do have an open door policy and that anyone can ask their questions. Secondly, we wanted to make sure that every family has the same opportunity to learn about development. We wanted to make sure that while targeting can work in some ways, we wanted that universal piece. Really building off of some of Clyde Hertzman's work that sort of taught us that a universal approach was really going to give us the best benefit rather than a targeted approach. And then, of course, raising awareness about development and of our community supports and services that are in place were really key pieces for us. And finally, to be able to refer families on for early intervention and to provide the supports and intervention activities. So usually that's the first goal, but that was for us sort of one that sat, but we really wanted to look at the other pieces of what we could do with the project. And we also talked a lot about families being unsure of where their children really should be at in terms of development, and we felt the ASQ tool itself was a great education tool, so we wanted to use it for that piece as well. So those were the goals that we laid out. Next slide, please. So we started what we call the ASQ Universal Offer, and the idea behind that was at the time, so we started the project in 2010. At the time, we were really looking for all families with 36-month-old children, 3-year-old children. So any service provider working with 3-year-old children would make an offer to the family upon the 3rd birthday to be able to do an ASQ. So that's where we kind of got started. But we really wanted to make sure that all of our service providers were supported in this work. So training was key, and then coordination went into it. We had to make sure that we had enough licenses in the community. You can't just have one license. You need to have a site license for each place you're offering. So there was some thought that went into that. The coordinator does the legwork, so I copy all the materials, make sure that all the resources are available to each of the service providers. We support our partners through providing the promotions. We have the posters, the brochures and all of that information. I do Facebook promotions to try and make sure that it sort of normalizes what the ASQ is. And then it's my job to tap into information, as Linette talked about, going on the wiki, going on the ASQ website, making sure that we have access to all of those great resources that are being developed for our service providers, so they don't have to spend that extra time. We did expand a few years ago into 18 months as well. So at this point, we're asking all service providers working with 18-month-olds and 3-year-olds to make the offer of an ASQ to those families. A lot of 18-month offers are made through public health. It was a great wish of theirs to be able to do an 18-month questionnaire, but they just don't have the time for follow-up there. So a lot of our project helps support that piece. In our project, the service provider is the preferred person to be able to do the scoring and have the conversation with the family, because they have that pre-existing safe relationship with the family. But that doesn't always happen, so we also have some fail-safes in place in case a service provider, for instance, a child care provider, can often have a hard time setting aside a confidential space and having time to meet with a parent a little bit more in depth. So we have a few processes in place to help support service providers so they can go ahead and make that offer, but if they can't score, myself as the coordinator is available, our ASQ partners are available, and we have an ASQ clinic available to help support that additional information for families. Next slide, please. And I'll just mention that the ASQ is also part of our Ready, Set, Learn events. We don't do ASQs on the ground at the event, but we do hand out packages and let parents know more about it because we're very specific to 3-year-olds at our Ready, Set, Learn events, so it fits in all of what we're doing. In terms of the outcomes that we've seen, I'm going to talk a bit more about the clinic separately, but in terms of the outcomes that we've seen, we have had a successful rollout of the universal offer. We have great engagement from our service providers. Not every single one is involved, of course, but everyone knows about it, and our service providers that are not trained or who do not wish to have do the scoring piece know that they have support in place to help with that piece. And I'll talk again about the ASQ clinic in just a moment. We do feel that we have made significant strides around reducing stigma. It is pretty normal in our community to get your ASQ, and now we have the opposite effect where we have families coming to us and saying, hey, I haven't got my ASQ yet, what's going on? And so they actually know to approach us. Or we have the impact of a family being offered an ASQ from multiple programs, and so they're saying, yeah, we've got that, we've been doing that, and so that makes sense for them. It's also been great to have checkpoints at 18 months and 36 months, because then we know that we've got sort of a trajectory over time, and families are being checked in a couple times and already know what the ASQ is all about. And one of the best pieces that we've seen happen is just that opportunity to discuss development. We know that it's a great education factor, and we can see families having their stress reduced. As I'm sure many of the people on the call have experienced, sometimes families are really stressed about what their child is not doing and thinking they should be able to do something that they're not ready for yet. And so it's great to have those conversations in a bit of an in-depth way, and that's really helped us. And of course, the ability to introduce intervention activities. So within our kits, we actually provide intervention activities regardless of whether we see the family bring the ASQ back. They've been sent home with some rich activities to do with their children, and we feel that that's a key positive piece. On to the last slide, please. So we've got the ASQ clinic that I'll just talk about a little bit. So this was developed in 2014, sort of in response to the rollout of the 18-month questionnaire. 36 months was really easy for us to encapsulate, and it was easy to work with preschools and Strong Start. But 18 months, it was a little bit harder to think about making sure we'd be able to capture all those families and have supports for them. And so we developed the clinic. The clinic isn't just for 18 months, it's for everyone, but that's sort of where the idea came from. The clinic itself is being staffed by our early interventionists, so we have speech language involved, public health, and infant development. It wasn't a tough sell for those individuals to be involved because we're only asking for one session every 6 weeks. So the commitment is a 2.5-hour session every 6 weeks for the service provider. On the other end, for families, a clinic is offered consistently every 2 weeks. So it gets advertised every 2 weeks that a clinic is coming up. Here's what it is. Here's what an ASQ is, and it helps keep us live and present in the community around the ASQ piece. And then for service providers, it's been a great connection in the earlier center to be able to be part of coming into the earlier center and meeting with families here. The other piece of the clinic is that we can book 30 or 45-minute appointments, and so families can have a really rich opportunity to be speaking with an early interventionist and really have education and quality time. And that's really been the biggest feedback we've had from our early interventionists in the room, is that families just have a ton of questions and they're getting them answered, and their stress is being reduced, and we're really loving that piece of it. The other part of the ASQ clinic was being able to offer the ASQ SE. In terms of the way that we've rolled out the ASQ 3, it just wasn't compatible with how we were trying to offer things to do the SE in the same way, but we wanted to be able to have the SE as an option for families, and having that richer time at the ASQ clinic allows us to do that and know that families will have all the time they need to review that process in a safe way. So, so we don't just do the ASQ at 18 months and 36 months. I want to be clear there. We offer the ASQ for any ages, and families can come in and ask for any age that they like. But we do have a focus on making sure that we are making the offer at 18 months and 36 months to make sure that there's 2 points of check-in for all families in our community. I'm going to end off there because I can see I'm almost out of time, and I want to make sure you have a moment for some questions.
Thanks so much, Tracy, and for bringing up some of the aspects that we hadn't really delved so deeply into, the idea of really taking a very much a structured approach to the planning of these events. You brought a very particular insight into making sure there are both public and private opportunities for parents to ask their questions, to really get to the heart of issues they may be concerned about in terms of development, and both having that as a broad public opportunity, but also having those private occasions for more personal conversations as well. I hope everyone noted just how critical in terms of that clinic model of having the partnership of public health, of therapists across developmental fields, and certainly that connection to the service providers who will be supporting the information and awareness and communicating to parents that consistent message. Thanks so much for bringing us that particular view into what is clearly a very strong and very thoughtful process and a screening network in your community of Revelstoke. So yes, we are just nearing the end of our time. Before we wrap things up, though, we're going to turn it over. Earlier, Linette had referenced Dory at the Human Early Learning Partnership, and although I'm sure all of you are very familiar with the Early Development Instrument, perhaps less so with the Toddler Developmental Index, the TDI, and it's, I guess, a new project at HELP, a relatively new one, thinking about assessment in the very early years. So we'll just get Dory on here to give us a quick sense of what that's about and how that might connect with some of the early years screening conversation we're talking about. Over to you, Dory.
Perfect. Thank you, Joseph. Hi, everyone. I'm Dory. I am a Master's of Public Health candidate at UBC, and I'm also a researcher at HELP. So the goal during the last 2 years at HELP was to develop a parent survey for 18-month-old children to collect population-level data on child development, and primarily to look into the contextual factors such as childhood experiences and the parents' experiences while they're upbringing their child, along with the social support that is available for the parent or the caregivers, and along with community resources. So in developing this questionnaire, we've had a lot of consults with different researchers and professionals in the field, and we've also conducted focus groups with over 200 plus parents and early childhood development professionals to gain feedback on which items are most beneficial to them moving forward. So the plan for the next 12 months will be to administer the TDI pilot version to different communities and with 300 plus parents in natural 18-month screening settings or immunization visits, along with early childhood development service delivery settings that are available. So I guess if you have any questions, you could direct them to Linette, and then she'd be able to forward it to me.
Great, thanks so much, Dory. And what we'll do is make sure that there is a bit more information connected with our follow-up email for all of those participating in today's webinar, as well as for those who will be watching it, I guess, at their leisure at another time. So thanks for that. Thanks for that context.
Great.
So to wrap up today's session, I know there's still lots of questions and probably some details that you're curious about from all the information you've heard, and really wanting to do the same incredible work and sort of building on the network and the system, accessing these resources. So you're in luck. Our next steps to follow up from our webinar is that Nicole will be sending out to you both the version that you can follow up of the webinar. As well, you'll be getting information on the TDI. We'll give you a bit more context about that, so you can be informed about the next steps and what's involved in that in a bit more detail. We'll certainly give that clear explanation of how to access the Interior Region Wiki space, and certainly you've already got the contact information for the presenters today, but we will make sure you've got that again in terms of following up with Linette and looking for support from her. We've got other resources. Sue Whitmore has mentioned to us about children in care and early years screening, I guess, activities that have been made available for children in care. So just some different contextual information about screening that's come about that may be of help to you in your community and in future steps in planning. So all of that will be coming to you in a follow-up email from Nicole in the next few days. So I think with that, that wraps up the end of our time today. And I think what I'll certainly once again just thank everyone for participating in today's webinar and providing your questions and your interest in this topic. Most of all, I'd like to thank our presenters, Linette, Patricia, Lynne, and Tracy, for bringing just a wealth of information about what's happening on the ground in the planning room, as it were, and working with families around early years screening outreach and events. And I'll just remind you that that's really the wealth of being an early years community developer in this province, is that we have a network and we have just a real richness of colleagues and a real collegial community. So please take advantage of it. Follow up with your colleagues who are doing such incredible work, and feel free to connect with Provincial Success by 6 office to help you make those connections, find mentors in the areas that you're looking to develop particular initiatives in the early years. And certainly just a reminder that our webinar series, while this is the end of that series, we will be having more webinars in the fall, and we'll look forward to having you join us on those. So with that, we'll wish you a beautiful afternoon, and we'll talk to you soon from the Provincial Office of the Early Years.